Hello, my name is Tahara Garcia and I'll be talking about tuberculosis.
I'm Daniela Lawrence, and I'll be talking about Pseudomonas.
My name is Monica Thomas, and I'm going to discuss Neisseria gonorrhea with you. And I have a joke for you today. Two parasites walk into a bar. The bartender says, "Get out, we don't serve any parasites here." Parasite says, "Well, you're not a very good host." I'm going to discuss Neisseria gonorrhea with you today. Neisseria are gram-negative cocci. They are positioned in pairs, and they're usually non-mobile. They have fimbriae and polysaccharide capsules, and their cell walls contain lipid A sugar molecules. Gonococci use their fimbriae and their capsules to attach to the epithelial cells of genital, urinary, and digestive tracts. Neisseria gonorrhoeae causes gonorrhea, which is a sexually transmitted disease. Most U.S. cases of gonorrhea are in adolescents. The disease is more prevalent among blacks than other races, and it is more common among women than men. Gonorrhea in women is frequently asymptomatic, but if there are symptoms, they're usually similar to a bladder or a yeast infection, and gonorrhea can cause pelvic inflammatory disease. In men, a swelling in the urethra can cause painful urination and a weeping discharge. If left untreated, gonorrhea can cause infertility. Gonococcal infection of the pharynx and the gums causes gingivitis and pharyngitis. Gonococci can travel to the bloodstream and cause arthritis, meningitis, and endocarditis. Gonococcal infection of the baby during childbirth can cause inflammation of the cornea or blindness. Gonorrhea can be diagnosed by the use of genetic probes to detect the Neisseria gonorrhoeae, and the Center for Disease Control recommends broad-spectrum antibiotics to treat gonorrhea. The best means of prevention are sexual abstinence, monogamy, and the use of condoms.
Some symptoms of gonorrhea include a discharge or burning sensation when urinating. Sometimes women with gonorrhea have vaginal bleeding between periods. It is important to know, though, that a person can be infected with gonorrhea even if they don't have symptoms. This is why it is important for you to discuss your sexual history with your physician to determine if you should be tested for gonorrhea. Gonorrhea can be easily cured with antibiotics. Even after treatment, though, a person can be reinfected if they have sex with someone who has gonorrhea. Anyone who has symptoms that continue for more than a few days after receiving medicine should contact their healthcare provider for a different type of antibiotic. For more information about gonorrhea and other STDs, visit www.cdc.gov/STD.
Tuberculosis is an infection caused by the Mycobacteria tuberculosis, also called tubercle bacillus. There are three types of tuberculosis: primary tuberculosis, secondary tuberculosis, and disseminated. Primary tuberculosis have 5 development stages. Stage 1, the respiratory tract gets infected by the Mycobacteria and respiratory droplets. Stage 2, the macrophages and the villi of the lungs are unable to digest the pathogens because the Mycobacteria prevents the building of lysosome or fibroblasts. Stage 3, the bacteria replicates within the host cells and kills them. Stage 4, infected macrophages attract normal macrophages and triggers inflammations. Macrophages surrounds the site of infection, forming a tubercle. Stage 5, body deposits collagen fibers, forming a barrier around the infected macrophages. The infected cells dies and release Mycobacteria tuberculosis, producing patches necrosis. Secondary tuberculosis occurs when the infected person becomes reinfected by Mycobacterium tuberculosis droplets. Cavities filled with Mycobacteria cells in the lungs. Secondary infections can happen years later when infected by tuberculosis. The bacteria spreads out through the lungs and the bronchioles. Disseminated tuberculosis is a contagious bacterial infection and is spread from the lungs to other parts of the body through the blood or Over one-third of the world's population is infected with Mycobacterium tuberculosis, and 10% of them develop a life-threatening case of tuberculosis. A person with a very low immunity has the greatest risk to catch tuberculosis. Other risk factors are diabetes, alcohol, chronic living conditions, poor nutrition, and drug abuse and smoking. Tuberculosis skin test is used to screen patients for possible chance of having tuberculosis. A positive tuberculin skin test is not sufficient to discriminate who have been exposed to antigens but are currently uninfected, although the patient can be a carrier of the active disease. Chest X-rays is used to reveal the presence of tubercles in the lung. Primary tuberculosis appears as tubercles in the lower and central area of the lungs. Secondary tuberculosis appear as tubercles in the higher areas of the lung. Recommending treatments of tuberculosis is a combination of different medicines.
Tuberculosis, called TB for short, is a disease that is caused by a bacterium called Mycobacterium tuberculosis. It is a serious infection, but is now infrequent in the United States. The infection primarily attacks the lungs of the patient, but there can be infection in other parts of the body in certain individuals. It is important when a person has active tuberculosis that they be diagnosed and treated by physicians. Tuberculosis is an airborne infectious disease that is spread person to person through infected droplets. If a person has active tuberculosis in their lungs and they cough or sneeze, those droplets could infect another person who is in close physical proximity to the person who has the infection. It is important to know, often be very tuberculous. If a person has these symptoms, it is important to seek immediate medical attention and be evaluated for tuberculosis. If a person has latent or sleeping TB, they are treated with antibiotics for either 4 months with a 2 antibiotic regimen or for 9 months with a single antibiotic as an outpatient. If a person has active tuberculosis of the lung and is considered to be contagious, they are generally hospitalized and treated with intensive antibiotics until they are no longer contagious. At that time, while they are able to return to the community, they are continued on anti-tuberculosis antibiotics, generally for many months thereafter.
For more information about tuberculosis and TB,
What are they? They fall in the class or category of gamma proteobacteria. They are gram-negative, they are aerobic, and they're bacilli. Where do they thrive? They are abundant in soil, swimming pools, and moist environments such as floor mops, washcloths, and sinks. There are 3 types of species of Pseudomonas. They are opportunistic pathogens: Pseudomonas aeruginosa, Varicella, and Acinetobacter. Pseudomonas aeruginosa. They have branch-like fingers or fimbriae that attach to the host cell, and there's an enzyme called neuraminidase that helps them with the attachment. They also have an exotoxin lipid A, which is present, and symptoms can include fever, vasodilation, shock, and inflammation. They have 2 toxins, exotoxin and exoenzyme S. They both obstruct protein synthesis. Who do they target? They target patients with cystic fibrosis. They feed off the mucus. It induces mucus production and grows more and more. It's a positive feedback. Diagnosis. It could be confusing due to many factors, including contamination during collection, transport, and inoculation. Treatment. It's tricky since it's resistant to many antibacterial agents, antimicrobial drugs, soaps, and antibacterial drugs. In healthy people, this bacterium does not do any harm, but it attacks patients with elevated health issues. Varicella. Varicella is a aerobic short bacilli. It causes infections in sinuses, bronchi, ears, and lungs. Treatment is erythromycin, tetracycline, and antibacterial drugs. And the final species is Acinetobacter. soil and water. It rarely, but when it does, you need to run tests to see the best treatment option.
In life, there are organisms we see and share life with. And then there are tiny creatures that share life with us and we don't get to see. These are the bacteria. One of these billions of bacteria is Pseudomonas aeruginosa. Pseudomonas aeruginosa is widely distributed in nature. It is a gram-negative rod. Almost all strains are encapsulated, motile by means of a single polar flagellum and several types of phyla, all of which are usually located at the same pole. It may colonize healthy humans without causing disease. Since their discovery during the 20th century, antimicrobial agents have substantially reduced the threat posed by infectious diseases. These gains are now seriously jeopardized by another recent development, the emergence and spread of microbes that are resistant to cheap and effective first-line drugs. The many gram-negative bacteria are resistant to many classes of antibiotics in most countries of the world, and the Pseudomonas aeruginosa is a clinically troublesome gram-negative opportunistic pathogen that causes a wide range of infections and a major cause of HAA outbreaks, especially among highly susceptible patients, and to a lesser degree, outpatient healthcare. One of the most worrisome characteristics of Pseudomonas aeruginosa is its low antibiotic susceptibility. Resistant hospital-acquired infections are expensive to control and extremely difficult to eradicate. Pseudomonas aeruginosa causes urinary tract infections, respiratory system infections, dermatitis, soft tissue infections, bacteremia, bone and joint infections, gastrointestinal infections, and a variety of particularly in patients with severe burns and cancer and AIDS patients who are immunosuppressed. The case fatality rate in these patients is near 50%. Pseudomonas aeruginosa is responsible for 16% of nosocomial pneumonia cases, 12% of hospital-acquired urinary tract infections, 8% of surgical wound infections, and 10% of bloodstream infections. The high mortality associated with Pseudomonas aeruginosa infections, particularly in immunocompromised patients, and the excess morbidity and mortality associated with ineffective empirical therapy in these infections. To prevent this problem, please be careful with using antibiotic treatment. And remember, the more we use these drugs, the more we increase the speed of emergence and selection of resistant bacteria.